All right, today we're digging into some really fascinating new health data. And what's wild is that it tells two completely different stories. I mean, one is this incredible success story, but the other, it uncovers a super surprising and honestly pretty urgent trend that's happening way, way faster than any scientist ever thought possible. Okay, let's kick things off with this number right here, minus 44%. So what is that? Well, believe it or not, that's the overall drop in the cancer death rate for Americans under 50, all the way from 1990 to just last year. I mean, that is a huge number. It represents decades of medical breakthroughs, and, on the surface, it looks like an absolutely massive win for public health. Right. So this really sets the stage for the big picture. When you kind of step back and look at all the data from a high level, the story seems overwhelmingly positive. Decades of research, amazing new treatments, and just better public awareness, it's all clearly made a monumental difference in the fight against cancer for younger adults, no question. And if you look here, you can see exactly where that success comes from. We're talking about these just dramatic drops in death rates for some of the biggest, scariest cancers out there. You've got lung cancer, breast cancer, leukemia. Their mortality rates have absolutely plummeted. I mean, these are the individual wins that all add up to that incredible 44% drop we just talked about. But, okay, this is where things get really interesting. This is where we have to put on our critical thinking hats, right? Because averages, as we know, can sometimes hide the most important details. And when you dig a little deeper into this data, you find one story that runs completely against the grain. It really debunks this whole idea that everything is moving in the right direction. And this slide just lays out that contradiction perfectly. On one hand, you have death rates for most major cancers in young people just falling, falling, falling. But then you have colorectal cancer. It's the only one that has shown a consistent, steady rise since back in 2005. Seriously, it's the one major cancer that's moving in the exact opposite and wrong direction. Okay, so before we go any further, we need to quickly get on the same page with two key terms, incidence and mortality. They're super important. So mortality, that's the number of deaths. That's what we're mostly focusing on today. But there's also incidence, and that's the number of new cases being diagnosed. And get this, separate research shows that incidence is also on the rise. Scientists think this is linked to stuff like obesity, diets with a lot of processed foods, and just sitting around more. So here's the bottom line. More young people are getting it, and more young people are dying from it. It's a double whammy. So the big question is, how did this happen, right? How did one single type of cancer manage to completely defy this massive positive trend that's been going on for decades? Well, let's take a look at the timeline, because this is where the story gets really alarming. I mean, look at this timeline. It is just staggering. If you go back to the early 90s, colorectal cancer was the number 5 cause of cancer death for young adults. Then, right around 2005, something flips. The trend completely reverses and it starts climbing. And by 2023, it has jumped all the way to number 1, the number 1 killer. It has completely reshuffled the deck. But here's the craziest part. This incredibly fast climb wasn't just a surprise. It completely shattered the timeline that cancer researchers had predicted. This just wasn't supposed to happen yet. Not for a long, long time. Just look at this quote. Back in 2021, so just a few years ago, a huge projection was published in the Journal of the American Medical Association, a really big deal. And it predicted that colorectal cancer would become the number 1 killer for young people by the year 2040. 2040, that was the official expert consensus. It's 2023. That's 17 years ahead of schedule. Let that sink in. 17 years. The future that scientists were warning us about, the one that was supposed to arrive in 2040, it's already here. It's now. And that shocking acceleration, well, that's the real core of this story. It just highlights how urgent it is that we figure out what is going on with this specific cancer. So what do we do with all this? Well, this data isn't just some interesting thing for scientists to debate. No way. It's a call to action for all of us. It completely debunks that old myth that cancer is just an older person's disease. And it's telling us loud and clear that we need to change how we think and what we do, starting right now. And a huge piece of the puzzle is right here. Get this. A staggering 3/4, that's 3 out of every 4 colorectal cancer patients under 50, are diagnosed when the disease is already at a late, more advanced stage. And obviously that makes treatment so much harder. This is exactly why awareness and catching this stuff early is just so vital. So, okay, what does this actually mean for you? The most important takeaway is knowing what to do. So, number one, know the symptoms. We're talking about things like blood in your stool or abdominal pain that just won't go away. Please do not ignore these signs. And number two, get screened. The official guidelines now say that average risk folks should start screening at age 45. But, and this is really important, if you have a family history or other risk factors, you absolutely need to talk to your doctor about getting screened even earlier. So, when you put it all together, this data gives us a crystal clear picture of what happened. We can see the trend, we've walked through the timeline, and we absolutely understand the stakes. But the most urgent question, the one that the entire scientific community is wrestling with right now, is why? Why is all this happening so much faster than anyone, any expert, ever predicted? Finding the answer to that question, well, that's the next great challenge.